Hello friends, how are you? Hope you are all doing fine. So, here is an overview of what we learned till now. For example, these are the codes. First, sepsis means we have, if the sepsis unspecified means we will go give this code, and if the organism is mentioned, we will code that one. If second one is severe sepsis means two codes. A 41.9, this is sepsis unspecified, and severe sepsis code. Along with, if any organ failure is mentioned, then we have to code the organ failure code also. Next, coming to sequencing of severe sepsis. If it is present on admission, then the sepsis will be the primary code. If it developed during an encounter, then it will be the secondary code. Next is the septic shock. Shock means first sepsis code, then severe sepsis with septic shock code, then organ failure if given. Next, if localized infection developed into sepsis. So depending upon the reason for admission, on admission if the sepsis is present, then the sepsis code will be the primary code and localized infection will be the secondary code. If sepsis is developed after admission, then localized infection will be the primary code because the reason for admission will be the localized infection. Then sepsis will be the secondary code. So next, coming to sepsis due to post-procedural infection. So infection means we have to code infection complication developed after procedure, this code, and sepsis code. Next, systemic infection, then organ failure code. So while studying all these codes, you may get confused, but when you practice, then it will be easy for you to understand what is what. Next is post-procedural septic shock. Shock means we have to code these codes. Post-procedural septic shock. First we have to code sepsis, then systemic infection. Then systemic infection means A code will be coming. What is the infection? What is the organism that is leading to infection? That code will come. Next is this post-procedural septic shock and organ failure if any. If mentioned, we have to code for organ failure also. Then next, the last one is non-infectious process, that is trauma or injury. Depending upon the reason for admission, we will code the sepsis as the primary code or sepsis as a secondary code. So coming to questions. Mr. Harry presented to ED with dizziness, vomiting and confused. After evaluation, Harry was diagnosed with Enterococcus sepsis with acute renal failure. Report the cause. So here Enterococcus sepsis. So the organism is also specified. So we have to give the specific code. So this is the unspecified sepsis. So this is not the answer. And it is also associated with failure, organ failure. Means it is severe sepsis. And we have to code the organ failure code also. Enterococcus sepsis code will be A4181, and coming to severe sepsis code R6520. 21 is for septic shock. 20 means only normal severe sepsis, and N17.9 means acute renal failure code. So this is the answer. Next question. Patient with pneumonia and sepsis came to ED. Pneumonia means local infection of the lungs, and sepsis came to ED. After admitting the hospital, provider did some test and confirmed that pneumonia is caused by Streptococcus group A organism. What are the appropriate codes? So here both the localized infection is there and sepsis is there. So the primary code will be the sepsis because it is a severe thing compared to pneumonia. It is a systemic infection. So we have to see, according to sequencing guidelines, we have to code first sepsis. Sepsis due to Streptococcus group A organism. When you will lead, you will get A40.0. And coming to pneumonia due to Streptococcus group A organism, this will be the code. Pneumonia Streptococcus specified form. We will get this code. So the answer is A40.0, J15.4. So next question. Michael came with Staphylococcus sepsis after surgery, and Michael went into post-procedural septic shock. So this is a direct question. So here post-procedural septic shock is mentioned. So the answer is post-procedural septic shock with initial encounter T81.44 XA And next we have to code the systemic infection. That means sepsis due to Staphylococcus aureus. Means sepsis due to Staphylococcus. This is the sepsis code. And coming to last code is the post-procedural septic shock. So this is the code. So how you will lead to the sepsis, post-procedural sepsis post-procedural initial encounter. So next code is the Staphylococcus sepsis, means sepsis with Staphylococcus. It is a direct code. And coming to post-procedural septic shock, how will you lead shock post-procedural septic? So you will leading to this code. So this is the answer. First code is for post-procedural sepsis, and second code is what is the organism that is causing sepsis, and third one is the post-procedural septic shock. The first code will represent will tell how the infection came, how the sepsis came. It is coming after a procedure. Next is the systemic infection, what is the organism that is causing the systemic infection, and last one is the septic shock code. So this is the answer. Hope you like this video. Thank you for watching this video. Please subscribe to my channel and share the video with your friends.